So today on Rebecca, we're going to be doing some cheek and jaw enhancement to really contour and lift the face. Rebecca would like to have a slimmer, more lifted, more rejuvenated face. So by using dermal fillers in these specific areas, we can lift the face, we can improve the contour and the shape of the face, and overall a more younger appearance. When we're assessing the whole of the face to look for areas where we can place dermal filler to achieve this look, we want to start to address any areas of volume loss. So the first place that we look with Rebecca is in the temples. And as you can see, she's got really good volume in the temples. There's no fat loss in this area. Then we can assess the cheeks, and she's got a very good zygomatic arch. She's got great width in the cheeks. But if we tilt her head down very slightly, we can see that this side, the left side, has more volume than the right. And there is a depression on this malar area of the cheek here, on this front part of the cheek. So this is an area where we'd like to address to at least give symmetry to the left side. Then when we look at the jaw, we can start to assess the shape of the jaw, the angle of the jaw, and also any jowls. And she's got the hint of a jowl starting. So when the face is viewed from front on, she looks like she's lost some of the lift in this lower face here and has a mild jowl appearing. So by using filler and improving the jawline here, we can start to lift and shape and minimize the appearance of this jowl. When we're marking up, we'll start with the cheek. If we are to assess the right hand side of the cheek, because we're not going to place any filler in the left today, on the right hand side we can see that there is a depression across the cheek in this area. So we want to place filler at the maximum point of the depression to lift the front of the cheek and improve the symmetry with the left side. So when we're marking up the jaw, it's really important to get the patient to sit up. So I've asked Rebecca to swing her legs off the side of the bed, sit up straight so we can assess the jaw in its neutral anatomical position. The first thing we'll do is we'll trace a line down along the back of the jaw, and then we're going to trace a line following the angle of the jaw down onto the jowl area. So this is the line that we're going to try to follow when we're shaping the jaw. You can see that there's a jowl here, and when she bites together, there's a muscle, the masseter muscle here, and we know that the artery, the facial artery, runs around here. Now the artery is deep, it's stuck on the bone, so when we do place the filler, we're going to use a cannula. We're going to make our injection point right over where the artery is, but we're going to lift the tissue and keep it in a superficial plane so we're nice and safe and away from it. We're going to use a cannula to then place the filler along this back edge to lift up the jaw and give increased volume and definition. When I use my finger, I can see that the angle of the jaw is here, but what we're going to be doing by placing filler in this area here, I'll just mark it so it's clearer. By placing filler here, we're going to recreate the angle so it will appear that the angle of the jaw is now up here. And with an increased angle here, increased volume down here, we'll lift it and reduce the appearance of the jowl. So we've marked up the cheeks and the jaw. Lastly, to finish off, there are two areas I'm going to place small amounts of filler. The first area is at the top of the nasolabial fold in what we call the piriform fossa. As you can see with Rebecca, she's got a triangular shape of volume loss at the top of the nasolabial fold. So we're going to place some filler down into that fossa to lift this out and improve the effect of the lifting on the mid-face. Lastly, we'll use some very light dermal filler in the oral commissures just to lift the corners of the mouth here, and also to soften any of these fine lines in the oral commissures and just to improve the overall aesthetic result. So when we're going to inject the cheek now, I'm going to use my non-injecting hand just to literally support the tissue, placing my index finger on the top of the cheek, underneath the eye, and my thumb below. So I know that the filler is going to go between my two fingers. Slight little bit of a slight pinch, just to make sure I've got enough tissue. And then this needle is going to go straight down all the way. So through where my injection point is, straight through, confident injection, quick through, and the bottom of the needle is just gently touching the bone. Then I ease off the bone slightly, and a slow injection in. Just placing very slowly, thumb pressing on the plunger, looking to deposit up to half a cc, but I might do it over a couple of injections. So 0.4 has gone in. I know that it's between these areas and I'm quickly out. And then I can assess the improved lift, gently press on it just to mold it into that area. So that's 0.4 of a cc. I've gently molded it onto the front of the cheek. I can see that it's got good lift. There's still a little bit of volume loss just to the back here, just to improve the contour. So I'm going to place a very small amount, maybe 0.1 cc, just here, just to improve that overall result. So exactly the same process again, non-injecting hand, thumb of the index finger, squeezing the tissue, locate where I'm going to inject, confidently down, little scratch, gently on the bone, and then a small deposit of filler, about 0.1. And out. And again, just so we don't get any bumps and it's molded to the cheek area. And then what I'll do is I'll come to the head of the bed just to now look down onto the cheeks and assess the symmetry. And I can see that we've got much better projection across this front of the cheek and overall a more symmetrical appearance. So from this angle now, with Rebecca's head turned to the left, we can see where the markings are, and we can actually see that the angle of the jaw is here. And you can see from our markings, we're going to be placing filler on the angle, but also beyond the angle, and we can see the depression of the tissue here. So the first thing to do is to make our cannula entry point with the needle. So the first thing I'm going to do is, again, with my non-injecting hand, just lift up the tissue, pinch it so the tissue is away from the bone. We know that the artery's around there, but it's stuck down to the bone. So this is a knife safe place to inject. We're going to hold our entry needle at about 30 degrees and in the direction of the line where we want to place the filler. So we're going to now go to our injection point, a quick injection in about 4 millimeters, and then can you see I'm still holding this tissue with my non-injecting hand, keeping the tissue supported, and all I'm going to do is just do a little bit of gentle pressure, lifting up the needle against the roof of the tissue above it. So lifting up against the skin, just widening the hole, but not actually moving the needle inside. So the tip of the needle is stationary, I'm just putting a bit of pressure in. This will allow the cannula to go through that entry hole much easier, make my life a lot easier, so don't rush this point. So lifting up, and then we can take that needle out. As you can see, there's no bleeding or bruising from that area. So as you can see from where we want to place the filler, we're going to use a cannula. Now this cannula is a 25 gauge cannula and it's 50 millimeters or 5 centimeters in length. So that's why we've made our entry point here. We've got the perfect length of cannula to enter through the injection point, advance deeply along the area we want to treat up to the new angle, and then we'll inject and withdraw the filler, creating more definition in this space here. So again, pinch the tissue. This will expose your entry hole, and using the same angle as we did with the injection needle, about 30 degrees, the cannula should just nicely flow through the hole and down. And then once we're in, we can just advance the cannula up to our point here, which is 5 centimeters, which is at the back of our marked area. Now, using my non-injecting hand, I like to place my index finger underneath the jaw to support the tissue, and then we're just going to start to slowly inject. Now I want most of my filler towards this new angle, so I'm going to place about half a cc in a bolus form, so in a ball of filler at this angle, before I start to withdraw. So I'm just slowly injecting, thumb on the plunger, slowly injecting the mylia extreme and adding the volume to the back of the jaw. Once we've got about halfway, so we've put half a cc in, We'll then start to slowly withdraw the cannula while injecting at the same time. Fingers still here supporting the tissue. So slow injection. We've got to halfway, and then we're just going to now slowly withdraw while continually injecting the filler. As you can see already, we've now started to create some good lift and definition along this new border and angle of the jawbone. So we've placed 1 cc in this area. We've got a great result, but I want some more definition just towards the back of the jaw, towards the new angle. So again, we're going to use half a cc, cannula through our entry point. See, it just glides in nice and easy. Index finger supporting the tissue, cannula running up to the back. I can feel where the edge of my cannula is. And now I'm just going to slowly inject the half a cc. I'll inject probably half of it just at the back, and then start to slowly withdraw the cannula while continually injecting until that half a cc is in position. And now I'm just going to gently massage along that area. So now I'm adding to the jaw in half a cc increments. So we've treated the cheek and the jaw. I'm just going to sit Rebecca up just a little bit and just show you the difference. So you can now see we've got good volume across the cheek and good symmetry, and I'm really pleased with the volume and the new angle of the jaw, and you can see how the jowl has been minimized by placing this filler here. So the untreated side versus treated side. So now we come to the left side. Again, exactly the same markings as before. We can see our entry point for the cannula is going to be made here by the X. We're going to advance the cannula in along this area. We're going to try and place most of our filler into this back part of the mandible. We can see as well from the markings the volume loss here, and the real angle of the mandible is here. We're going to now try to make our new angle appear in a higher position further back with the filler. So first step is to make our cannula entry hole. So again, with the non-injecting hand, just pinching gently that tissue, lifting it off the bone, well away from the artery stuck down on the bone. We're going to use our needle. We're going to approach at about a 30-degree angle in the direction of the line where we want to place the filler. It's going to be a quick injection in, quick scratch, 4 to 5 millimeters in, and then just, again, supporting the tissue and just lifting up, keeping the end of the needle still inside, but just lifting up to create a little bit of upwards traction on the hole, just to widen the hole and allow the cannula to enter in a smoother manner. We're not rushing. We're just lifting up. And we're out. So now we're going to place the filler again, 5 centimeter cannula in that region, lift the tissue, cannula should just slide easily in, and then we can advance the cannula using the tip of the index finger to locate the end of the cannula. I can feel it clearly underneath the skin in our area, and then index finger underneath the jaw, supporting the jaw, and starting to slowly press the plunger, injecting the filler at the back around the new angle, slowly lifting the area with the filler, looking to place half a cc at the back before I even move the cannula. Once we've placed the half a cc, We're going to then now start to slowly withdraw while continually injecting the filler along the line of the intended placement. It's a nice, smooth, fluid motion. Slow injecting, slow withdrawal. Until we've placed 1 cc of the Miley Extreme and we're out. Now we're just going to feel where the filler is. There's great placement there. That's 1 cc, so less on this side. She had less volume loss on the left hand side. And then we're going to assess, we want a little bit more filler at the angle again, and maybe a little bit more just near the entry hole. So we'll go back in with another half a cc to tweak and augment before we reassess her fully. So I'm just going to top up again. So we're topping up, pinching the tissue, lifting it away, cannula nicely in to the angle, and again finger supporting it and placing most of this half a cc towards the back, really lifting that jaw, and then moving the cannula to near the entry point to where we want a little bit extra filler. So when it comes to injecting the top of the nasolabial fold in this piriform fossa, what we're going to do is we're going to use an injection, but to make it safe, because of the angular artery that runs along the base of the nose through the piriform fossa, we're going to take extra precautions by aspirating before we inject. So I've placed a fresh needle on this syringe, however I haven't primed the needle, so this is a non-primed needle, and also I like to thumb aspirate, so I use my thumb to aspirate. So what I'm going to do is I'm going to twist the plunger so it's 90 degrees. So I've twisted it from there to there. So it means that when I'm injecting, I can easily get my thumb back to lift the plunger out. Now we're going to inject deep into the piriform fossa. We're going to make our injection point where the X is here, and we're going to aim it slightly towards the base of the nose. So straight down, and we're going to touch the bone. Now, using my thumb, I'm aspirating. There's no flashback in the syringe, there's no blood, so we know we're not in an artery, and I'm going to slowly inject the filler into this area. You okay there? Mm-hmm. Slowly inject, lifting the tissue and out. And now a little bit of massage in that area just to soften it down, and you can see there that we've got good lift, good improvement here, correction, whereas we're more sunken on the left side. We're going to repeat the process on that side. So we're going to do the left piriform now, exactly the same procedure. I'm now using a fresh syringe of Miley Extreme. If you are going to use half a cc and then put the other half a cc from the same syringe, always put a fresh needle. So when you go into the net, when you re-inject the piriform, always place a fresh, unprimed needle in the syringe. Again, twist your plunger, and again, we're going to now deep injection, angle towards the base of the nose. Aspirate, we can see the air come back, there's no blood, we're down on the bone, and we're just going to slowly inject. This injection in the piriform can cause some numbness and anaesthesia for about an hour in the top lip and even the top teeth. So we put half a cc in, and we're withdrawing, and some gentle massage in the area just to smooth out any bumps, and that's done. So now we're going to use the Miley Precise, the very light filler in the oral commissures, just to lift the corners of the mouth and maybe just correct this line here in the oral commissures just there. So the first thing we're going to do, we're going to use a needle. We're not going to use a cannula. We're going to get Rebecca to open her mouth just slightly, just to expose the corners. I'm going to retract the tissue. You can see I'm using my thumb and my index finger to stretch the tissue and retract it. Just open your mouth a little bit more, and then the needle's 1 centimeter long. So along the line of the oral commissures, 1 centimeter away, I'm going to inject quite superficially. So a little scratch, and then I'm going to advance the cannula, then I'm going to advance the needle into the oral commissures. And now I'm just going to slowly start to inject while withdrawing my needle, and then before withdrawing the needle, re-advancing the needle in a different direction. So just a small, concise, fan-shaped placement of filler into the oral commissures, just to support that tissue. And out. And now just open your mouth for me. It's really important you just massage this area just to avoid the filler clumping together and creating an unnatural feeling for the patient. And close your mouth for me. Okay, and we can see already we've got good lift on this side. I'll just tilt your head. You can see already the lift now that we've got on this side compared to that side. Before I move to the other side, I'm going to just very, very gently place a little bit of filler in this fine line here. So the line, the wrinkle is about 1 centimeter long. So that's where I want to place the filler. I'm just going to very superficially inject. So I'm just putting my needle I'm lifting my needle up so you can see how superficial I am. And I'm just going to place a very small amount of filler, injecting while withdrawing along that line, just to lift that line out. Only need a very small amount of filler to do that. And again, because it's superficial, just massage afterwards, just to make sure that you've got no lumps, visible lumps of filler underneath the skin. So now we come to the other side. So exactly the same procedure, just open your mouth a little bit, that's right, retract the tissue. So using the index finger and your thumb to stretch the tissue to expose the oral commissures 1 centimeter out into the corner of the mouth, nice and superficial. So you can lift the needle, it's superficial, and we're just now placing filler at that or directly at the oral commissures, slowly retracting without removing the needle from the skin, re-advancing in slightly different direction, just in this fan technique. This will give us the best lift with the smallest amount of filler. And out, and open your mouth for me. Index finger inside the mouth and gently on the thumb, just to massage and make sure there's no obvious lumps or bumps of filler. And let go, and then we can just reassess. I'm going to put a fraction more just into that oral commissure. Same technique again, nice and superficial into the oral commissures, really lifting that up and out, and that's half a cc in. Just open your mouth for me again, massage, make sure it's smooth, and that's done. And if you lift your head up for me and look straight ahead, you can see that we've improved that commissure there. So when we look at Rebecca from the front, because we've placed the filler here, what we've done is we've minimized the jowl effect and changed the shape so she's got more of a V shape in her face now, or heart shape. We've also injected the piriforms, which has given great lift, softened out the nasolabial folds and lifted this mid-face, and we've lifted the corners of the mouth with the filler at the oral commissures. So just in summary, in terms of the filler we've used and the type of filler, so we've used 5.5 mils or 5.5 cc of Miley Extreme. We've placed half a cc in this right cheek here. We've then used 2 mils or 2 cc's of Miley Extreme on each side of the jaw. That was the necessary amount to give us that volume and the lift and the shape that we wanted. We've then used a further cc of Miley Extreme in the piriform. I always use the heavy fillers there, half a cc on each side. And to finish off in the oral commissures, we've used Miley Precise, which is our lightest filler, half a cc on each side. So 6.5 mils in total, 5.5 of them Miley Extreme, 1 of them Miley Precise.